everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section has to do with the benefits of adding ancillary services to any midwifery practice. Legal disclaimer we put at the beginning of all of our presentations. This information is for educational purposes only. Content is not intended to substitute for legal, professional, or clinical advice. We strive to keep our information as accurate as possible, but make no guarantees on the adequacy. The course objectives: the student will be able to verbalize what are the services midwives can provide. They will also be able to verbalize exactly what is an ancillary service. They'll be able to verbalize the benefits of adding ancillary services to any midwifery practice, and the students will be able to verbalize some examples of ancillary services that they can add to their practice. So why is this topic important? I think as midwives, particularly in my consulting business, I hear so often the mindset of being self-employed, exchanging your own time for money, doing the traditional birth things, home birth practice, birth center practice, and there's a lot of stressors with the unpredictability of risking out, the highs and lows, the demands, your time that's committed to those things. So a lot of times I talk to practices, whether they're starting out or expanding, the power of ancillary services. Ancillary services can increase financial freedom, can reduce the risk to the practice, reduce the risk of burnout. It improves the quality of care because you've got a lot of services under one space. Some of these things are part of the scope of midwives that they're currently not utilizing as services, and then some of the things are people you can add onto your team to add those services. The challenge with midwives is trying to be creative with our healthcare businesses, the revenue streams, particularly if you're taking insurance. There's only so much you can do with an office visit and codes, but if you start adding ancillary services, you really diversify and reduce the risk for your business, increase revenue, and support your families better. You want to do procedures, colonoscopies, pap smears, gynecological services. The list can go on and on and on of what we can offer as midwives, plus what we could hire onto our team. So as healthcare gets more and more expensive, and especially the obstetrical side, the malpractice is rising, clients, we want to have high quality care, so we want to keep our birth numbers low. You have to bring in revenue from other sources to complement and diversify the strength of your practice. So some of the different diagnostic and supportive measures that can be used, we've listed some examples. It could be while they're in the hospital, it could be at a birth center, it could be a women's health clinic, it could be an outpatient urgent care. I mean, the list can go on and on. I've seen some amazing ancillary service relationships with ultrasound techs, with physical therapists that specialize in pelvic floor therapy, urinary incontinence, menopausal hormonal therapies. Get creative within your practice, childbirth education, doula services, lactation services. What are services your women would like to have, would like to be part of, that may or may not exist already in your community? Don't just think about the traditional medical things. They are an option, but get creative. As midwives, we do so many wonderful alternative therapies. Get a naturopath, get a chiropractor, get massage, get acupuncture. Think about all these amazing things that you can bring under your umbrella and transition to a full women's support center versus just maternity care, which is traditionally what midwives do. There's a lot of different places that these services can be. I encourage, even if you're doing a home birth practice, get a clinic, get a community center, rent out other space, have the best of both worlds where down the hallway you can refer to all these wonderful people. Maybe you don't want them under your practice, but you can easily get a property manager, buy a building. There's so many tax benefits for a midwifery practice to have a building and rent to other awesome services. Then you know who your neighbor is. If you need to expand, especially birth centers. I see so many birth centers, they lease and they put $200,000-$300,000 into a birth center space, and then the lease ends and they have to move somewhere else and they've lost that construction revenue. So I always stress the power of looking at the different facility locations, looking at the different ways, not just today what your services are going to be, but in the future. And there's so many benefits if you own the community center and you rent out to all these wonderful ancillary services. You don't necessarily have to have them under your own practice umbrella if you don't want to. For example, like a hospital or a birth center, they can add pharmacy, they can add daycare for their staff and for their clients, they can add massage, they can add yoga studios, educational courses, nutrition. The list can go on and on and on. It's really just a limit of your imagination of what services you could potentially add. If you're running lab tests, some people will just refer out for that, but does it make cost-effective sense to have the lab services under your ancillary service umbrella? Ultrasounds. I've been working with a lot of clients, and the financial value of having ultrasounds in-house plus the benefit to those moms, particularly if you're trying to do a heartbeat at 9, 10, 11 weeks gestation and you don't get it with a Doppler, you can easily grab your ultrasound machine versus you send them to the hospital, and it takes some time and they're anxious and stressed out. So there's a lot of benefits to having some of these services you would refer out to. They may have to pay more for, they have to drive somewhere, they have to get an appointment. If you can have specialists, if you can have obstetricians, you can have MFMs in the building, you can have a family nurse practitioner to send your babies to after the first month of life. There's so many benefits of that continuity of care, continuing the philosophy and the mission of services that you've been offering within your practice. So there's a lot of different ways you can do this. You can have it as part of your umbrella services. You can have it outsourced and you get a referral cut. You could rent to that person and make a centralized community center. There's a lot of great ways to add medical testing, supplement services, specialist referrals, procedures that maybe you get some extra training and certifications with, homeopathies, with, there's so many amazing, I'm thinking of like energy release and some of these alternative therapies, Reiki. You could become a niche in your community if that's something you want to do. Otherwise, you can hire people. I always stress to midwives, I want you to transition from being business owners from the original self-employment. I want midwives to gradually start thinking, how can I create business operational systems that'll support the community versus I directly have to offer that service. I directly have to be the one running it, because we're only one person, and that limits our opportunities of serving more people when we just use only our time exchanged for money. So the benefits to a midwifery practice, the list goes on and on and on. And this is just in life in general. The more revenue streams, passive income, ancillary services you add into life, the better you're going to be for opportunities, financially free. There's so many benefits to adding ancillary services directly to a midwifery practice and into your life. The obvious one is the more revenue streams with staff, with operations, with services, with systems you put into place, the more revenue that comes into your practice, into your life. And it also gives you the choice, instead of taking 6-8 clients a month for birth, you could take 2 to 4 clients a month, give them far better care, not be on birth call as much for yourself, and you could add other midwives to the team. But it gives you the opportunity to say, I'm going to get revenue streams from something that's not on demand of my time as much. And now I get to get better client relationships because I've got other revenue streams supporting the practice long term. So the other benefits, it adds to the staffing resiliency. The more services you have, the more team you have in place. It's a lot harder to support a solo midwife practice with a birth assistant if someone gets sick, if something's going on, versus you have multiple ancillary services. You have more staff on the team that can cross-train, that can support each other more. The burnout for your practice as a whole reduces drastically once you start getting at least 5 to 7 staff on board, especially in similar occupations, because they can support each other. So you add on an ultrasound tech that also can draw labs. If the lab person doesn't show up that day, the ultrasound tech kind of rearrange the schedule a little bit, help with labs. So it's really important to understand the adaptability, the ever-changing needs of a practice can be stronger with more ancillary services. The other thing is the benefits to a community, especially a rural community. You got to drive 2 hours to even find a certain unique service. The more you can add specialized care locally, the more it's going to get your reputation. People are willing to pay more for it. In today's healthcare age, people are researching alternatives and supplements and being as healthy as they can. With the pandemic and with the broken healthcare system, people are really questioning and going back to decentralized healthcare system models. So I do see a lot more private practices coming around, but they have to be strong business owners. We can't just have a bunch of midwives and healthcare practitioners opening shop when they don't understand tax and legal and the benefits of having ancillary services and running a successful business versus just taking care of people. You have to be very highly educated. You have to find the experts, the best of the best in the field, the best lactation consultant in your community, the best childbirth educator, the best doula agency you could create, the best family nurse practitioner, pediatricians, chiropractors. You want the best so that you're branded as that high quality, and the services, they will pay what your fee schedule is willing to offer based on that value. So these are typical things I see with midwives across the country. It doesn't matter if you're a certified nurse midwife, certified professional midwife, direct entry midwife, licensed midwife, religious midwife, the list goes on and on and on. Most midwives do birth. Most midwives in private community-based setting. There's a few that do women's health clinics, and I would love to see more of that model of services, but most of them do births, and they just keep their overhead simple, their services simple. They do prenatal care, birth, postpartum, sometimes newborn care the first month of life. So then your service line is very vulnerable, because if you're doing insurance, yes, if you're cash up front and it's all or nothing, that's one thing. But if they move away, they risk out before that full payment is due, or your insurance, and all of a sudden you don't do the birth for them, you've lost 60-70% of the revenue for all the care being offered. And that's a huge hit, and that's something I noticed with my private practice. When we didn't have enough ancillary services, I would cry those months when half the people would risk out for the practice, because I knew in 3-4 months when the insurance would process, it would be rough, because we did all that hard work, but they transferred. We didn't get to do the typical codes to the insurance company. It's really important for midwives to think about, how can I add extra services? They may or may not be things you are directly doing. Maybe you have a passion for something you're going to do 1 to 2 days a week in the office, Monday through Friday, 8 to 5, some sort of structured system, and take away 1 birth a month. Or you're going to keep your birth volume the same, but you're going to add somebody to your team that specializes. They work 2 days a week. You did your number crunching. It's awesome revenue for them to join your team. You definitely want to look and see what is typical of a midwife and what are some creative things that we can offer or we can have join our practice by someone else. So postpartum care, it's typically done right after birth up to 6 weeks postpartum. There is a code with insurance for that, a CPT code, but I always stress those home visits are additional above and beyond. We usually in a community-based setting will do a day 1 postpartum visit, because they're either, if you're a home birth, you're there around 2 hours, and if it's a birth center, they leave in 4 to 6 hours. So that day 1 is essential. There's a lot of transitions with the mom and baby that are usually checked on in the hospital setting. Day 5, 2 weeks, and 6 weeks. And I always challenge midwives, like day 1, I do think a midwife or a highly skilled midwife apprentice, a nurse should do that visit, because there's so much going on with screenings and testings and transition. But the day 5 and the 2 week could easily be done by a doula, a birth assistant, a nurse, a lactation consultant, someone to help you with giving a specialist in a different area. And then you do the 6 week visit, traditionally talking about contraception, seeing how transition going, ending that maternity care services. So these are things I traditionally see in the home and the birth center setting, is just the prenatal care, birth, postpartum, home visits, sometimes newborn care, sometimes not. So the newborn care, I think it's great if we can offer it the first month of life. It's an extra 20-30% revenue to your practice if you're billing insurance versus your global cash, including it part of your care. I see a lot of, because our philosophy is so different than a lot of pediatricians and how they're trained, a lot less interventions for the baby the first month of life, a lot more success rates with breastfeeding, normal growth curves, less postpartum mental health disorders, because we're looking at the mom and the baby like they're a symbiotic relationship. So I love it when midwives take advantage of our full scope and do the newborn care the first month of life. But you've got to have a good collaborating relationship with a peds, a family practice provider, if something is outside of your scope, and after the first month of life that they transition to. Similar to prenatal care for the mom and birth, you want to have an obstetrician, someone that can help with referrals. The same thing goes to have in place the newborn care. So these other things I see midwives sometimes offer. I don't think it's personally the best use of our direct time to do childbirth education, doula services, lactation support. If you love to do it, awesome, great. But I'm just stressing, based on our skill set and value, find a phenomenal lactation counselor, lactation consultant. Find an awesome doula, childbirth educator that can be on your team. It's far more valuable of your time to focus on the procedures, the skills, the services that only a midwife can offer. If you've got other people that they specialize in these parts, these are excellent ancillary services, particularly if you are a women's health clinic or you are a practice that chooses to be in network with the Affordable Care Act. The code 99404 is an excellent code to collaborate with a lactation consultant in your community to offer those services under your practice and be able to share the revenue. It'll benefit the families greatly in the community. They now don't have to pay cash for that private lactation consultant, and a lot of insurance will pay 6 to 8 visits per calendar year that'll have great benefits to the families to focus on preventative lactation support, not just problem lactation support. Our culture has shifted greatly. The only time, quote unquote, you should call a lactation consultant is if you've got a severe problem or issue, because most people can't afford $200-300 for a lactation visit out of pocket when they've already paid out of pocket for their midwife and all these other things. Having a baby's expensive. So I love when we can team up with ancillary services. If you are a practice that has in-network contracts, there's a lot of benefits to getting a lactation counselor or a consultant on your team. There's a couple codes for childbirth education, but most of the time that's cash. There's a lot of resources and styles for childbirth education, but that's an awesome ancillary service to add to your team and get someone on so your clients, you know the style of education they're getting. It'll help improve the birth. It'll help decrease the calls for triage and questions when they've had proper education. So these are other typical services midwife practices offer. It's very interesting. I think certified nurse midwives, it's more part of their scope. Certified professional midwives will typically refer out for the gynecological and contraception services. Some of them are trained with their preceptors, but I would say most of the certified professional midwives tend to just stick with the maternity obstetrical side of things, not so much gynecological. If you're a women's health clinic, you're in network with insurance companies, contraception counseling is typically covered 100% as long as it's not a grandfathered in insurance plan. Pelvic plane, I mean, too many times our national average across the country is having 2 babies. People learn about midwives after they've had a bad experience. They're older, they're well educated, they've had kids before. That's the stereotype. So if you serve an Amish Mennonite community, you're not going to have a high turnover of staff. They're going to have one baby with you and have a relationship the next 20 years. But the traditional English community, they're having 1, maybe 2 babies with you on average, and you need to have some other revenue streams, some other continued relationship opportunities to use with them. So you definitely want to look at gynecological services, help them with well woman care. After having a baby, I think all women should have pelvic floor evaluation. See how things are going. Did things heal correctly? Are there any sexual health discomforts, issues? It's an area of women's health care that is not being met at all with sexual health services. And they would much prefer talking to a woman, a midwife, someone that can relate to their body and empathetic and understand to help them solve those more sensitive personal concerns. There's some other services that midwives can offer. Primary care. I think this is one that's really forgotten by midwives. We can do colds, we can do thyroid, hypertension, diabetes, before and after pregnancy, we can be their primary care provider. It's part of our scope of services. I know that most midwives aren't trained in it or aren't comfortable in it or really just don't keep up with the data, but it's really important, like for smoking, substance abuse, stress, weight loss, mental health concerns. We can take care of them outside of pregnancy for all these wonderful services. And so I just always want to challenge midwives. Look at your practice, look what you love to do, look what you're currently offering. Do you want to expand your services, get some training, some certifications, or do you want to add people onto your team that can offer like-minded services and continue? I would have all the time, it would be awesome to add a family nurse practitioner because we'd have dads, we'd have children, and the midwife can't take care of them that would need additional support. So the family nurse practitioner on the team could do awesome services to truly take care of the whole family unit. So these are some traditional things that I've seen midwives offer with women's health clinics or choosing to do gynecological services part of their home birth center practice. Well, women care, breast exams, pap smears, pelvic issues, discharge, STD screenings. The list can go on and on and on, and it's really nice to give the midwifery model a care for those aspects of services. So these are traditional things getting you to think outside the box, whether it's you offer directly and get some training or you have someone on your team. You can refer out to mammograms or you could choose to have mammograms. You could refer out for bone density screenings for postmenopausal women, or you could have that service in-house depending on your niche and services. My whole goal of this is just to challenge you to think outside the box. There are so many ancillary additional services you can offer with your team, creating operation systems that'll have massive benefits to the practice. So you can choose to do colposcopies, you could choose to do endometrial biopsies, you could choose to do endless amount of procedures, part of women's healthcare if you chose to get the training and wanted to add that. I know some amazing midwives that do sexual health strictly, that do urinary incontinence, pelvic pain. They focus on certain aspects, and that's okay if you want to be a niche service, but just understanding the more narrowed your service line is, the more vulnerable your practice is if something happens to that service line. You could do lab testing, you could do ultrasounds, you could do genetic testing on site, you can do so many things, or you can just refer out. That's your choice, but I just want people to know available. You can offer more therapeutic services, spa, massage, boutique things, occupational health. You could even offer services for the newborn, frenectomies if there's no one in the area that does it, mental health services. There's just so much out there that can be helping with exercise, weight loss. If they have diastasis recti after delivery, you could specialize and get a specific program that your clients follow the next 3 to 6 months service. There's so much available and out there. So you can focus on nutrition, you could get diabetes, you could do centering pregnancy, you could do weight loss management, you could do supplements, you could have a shop, you could have local organic foods, and you could have a farmer's market in your parking lot. You could truly decide what is the mission, what is the goal of your practice, and how are you going to serve the families best with those additional services. It's interesting, the cosmetic things. Some people don't think of that as midwifery because it's more high end, it's an elective, it's more of making you feel good, but there's a lot of benefits to the mental health and the spiritual and making you feel inside and outside well. It's a higher, unfortunate revenue stream to add Botox, to add these cosmetic procedures. IV infusions is a really interesting one, especially across the country with COVID and so much going outpatient, and just the fatigue with our healthcare providers and our consumers alike. There's so many electrolytes and vitamin infusions and clinics popping up all over the country. You could choose to add IV infusions. You could add iron, you could add vitamin C, you could add so many electrolyte infusions and really benefit your clients, benefit yourself, benefit the community. And the overhead's not too bad with the IV infusion. So I always love that one. When we talk about simple things to add, adding ultrasounds, adding lactation consultant, adding IV infusions tend to be the low-hanging fruit to really get the best bang for the buck. So yeah, massage, pampering, child care resources, so that what are the barriers the moms are having to come see services? Maybe they would love to have a full spa day, but they can't find a babysitter. So if you add in your practice ancillary services that aren't just directly serving the clients, but bridging those barriers. Maybe you're in a low income area and transportation is a challenge. Talk to your local bus route to see if they can come by your practice. So sometimes it's not even about just adding an ancillary service directly for you, but adding resources so that you can bridge the barriers so that they're more successful coming to see you. You could product promote. I don't think midwives, I talk often about the 4 values to create wealth in your life. The one that most people think about is money, time and money. I am going to work for someone, I am going to provide a direct service, and they're going to pay me X amount for my time involved. And that's one aspect, but it's the hardest to work for. So I always challenge midwives to think about the other 3 forms of currency value creation in your life. Your relationships, so those referrals, the cross referrals, you sending people to a childbirth educator, lactation, you should be getting a referral kickback from that because you're adding value to their practice. The knowledge, the things you know, the value you're creating, how can you put a price on making their birth the best possible? It's not just the time you spent in front of them and labor support, it's the knowledge, it's the education, it's the supporting a birth environment experience with your knowledge and expertise to give them great outcomes, to give them physiological birth. That has a financial value to it. And how do you turn it into a product? How do you turn it into a service? The last option is value. Out of the 4 currencies, time, knowledge, relationships, value. So the more value you add, the more wealth creation you get. So the more systems you make, the more products you promote, the more resources you create for a community to serve more people, the more financial value you get from that. So product promotion, I don't think midwives give enough credit of how much expertise and recommendations have financial value to them. You can make it as simple as saying, I love doTERRA. I love this specific brand, company, essential oil, herbs, supplement. And you don't have to have the products in your store and sell them and worry about sales tax. You could easily talk to the company and become a marketing affiliate. Obviously, you'd put a disclosure to your clients, get a simple flyer put together, have a QR code, have a simple marketing affiliate link that they click on. And when they buy the product online from your referral link, you get a kickback, you get a cut. So I think sometimes we think of ancillary services of tangible, we have to create the systems. There's many systems already out there. You just have to tap into value creation with them. So that's a one I love to add simple, like, hey, midwives, who are you always referring to? Oh, I refer to this awesome pediatrician, physical therapist. You could do a cross referral, or you could get financially compensated for that referral. Or with products, you're always talking about this special iron and prenatal vitamins and this awesome thing you did lots of research on product, especially our ladies with the sexual health boutique practices. The clients really respect the provider's recommendations, and 99% of the time they buy what the midwives, the healthcare practitioners are recommending. So you should get a cut from that. You're being a representative of that product or service. You could choose to have a boutique shop in your clinic. It could be simple with supplements. It could be a full line crafts and newborn things, breastfeeding support, pelvic floor, the whole primary care and mental health and weight loss. The list could go on and on what you want to have in that boutique shop. I do encourage midwives to make that a separate business entity. It's totally different than our service line, the industry, the taxes. I do encourage midwives just to at least make that a separate LLC, S corporation under their umbrella of services. So just as an overall summary, I really want to stress the power of diversifying and ancillary services to any business, particularly midwives. We want to give high quality care. We don't want to be an assembly line like the hospital. We don't want to take 8, 10, 12, 14 births a month, and then you don't have that relationship. You miss births, you're burnout, you're exhausted. I see it over and over and over again. So this is important to me that midwives understand the power of diversifying services, adding people to the team, creating systems and service lines within your practice to help with the highs and lows of unpredictabilities of birth, to be able to take 2 to 4 clients a month and still make your bills and still do all the wonderful things you want to do, because you've created, I usually recommend 30% obstetrical service line within a midwifery practice, and 70% is all these other ancillary services, because you're leveraging the experts around you. You're exchanging their time, their knowledge, their expertise in the systems, the service, the branding you've created. So there's a lot of different business models out there. One is not right or wrong depending on your community, your mission, where you want to go. But I just wanted to challenge you to think about, in your local area, what is a simple service line you can add that's not high overhead, there's somebody out in the community that's already doing it. You guys would benefit from a win-win situation to join forces together, particularly lactation consultants, doulas, childbirth educators, naturopaths, chiropractors, people already doing things, but you guys can take each other's practices to the next level by having a cross referral or directly having an ancillary service. They come to your practice one day a week and support your family. So there's lots of ways to do it. But I love helping midwives. I love helping healthcare providers so that we are preventing burnout. We're loving our practice. Our practice can run when we go take a break. I think I hear it too many times. When I go on vacation, my money stops. I have to take 6 weeks off of birth. It's a huge financial drain when 100% of your revenue stream is from birth call demands. If we can start shifting that, where you are getting ancillary services, wonderful things, part of your umbrella, part of your team, you can make it as complicated and as simple as you want, but it will have immense value, short-term and long-term, to your business, to the community, to your opportunities in life.